Hi everyone, I'm Ali Bassir, a research fellow in Department of Radiology at UCLA. I would like to present our study, which is assessment of transurethral ultrasound ablation of prostate, or TULSA, with MR thermometry parameter and clinical response at 4 years of follow-up. MRI-guided transurethral ultrasound ablation of TULSA is a novel, minimally invasive procedure that transuretrally delivers therapeutic ultrasound to ablate the whole prostate tissue through thermal coagulation. MRI scans are contoured and used to guide this treatment. TULSA delivers high-intensity ultrasound, which is focused on the blade from the inside of the gland and transmit energy to a whole prostate. The advantage of the TULSA is that we can monitor the whole procedure through MR thermometry. For example, if the temperature is above the treatment range, we can stop delivering ultrasound temporarily. Another advantage of TULSA is the active cooling system of urethra and rectum that helps to prevent any damage to adjacent organ. Live T2 and diffusion images are used for planning this procedure. Also, MR thermometry is used to monitor the delivered dose in real time. In addition, there is an automated thermal modulation which controls rotation rate, frequency, and output power based on MR thermometry. Let's briefly talk about TULSA ablation clinical trial ULTAC. In this study, 150 men with a mild and moderate grade prostate cancer from 30 centers were treated with a whole gland ablation. Inclusion criteria were biopsy-confirmed prostate cancer, Gleason score less than 3+4, PSA less than 50 nanogram per milliliter, and prostate volume less than 90 cc. This study showed safety and efficacy of TULSA. We evaluated a subcohort of TAC study consisting of patients treated with TULSA at our institution. Clinical and MR thermometry parameters were evaluated during 4 years of follow-up. Inclusion and exclusion criteria were exactly same as TAC study. Clinical parameters were PSA and prostate biopsy. MR thermometry parameters were cumulative maximum temperature, or Tmax, and thermal dose cumulative minutes at 43 degrees Celsius. Adequate treatment according to Tmax and thermal dose was defined as Tmax greater than 55 degrees Celsius and thermal dose greater than 240 cm 43. We also analyzed the periurethral volume with a radius of 2.5 millimeter isocontour on MR thermometry to assess overheated area, defined as Tmax greater than 86 degrees Celsius. At baseline, 17 malignant lesions were found in 9 patients. At 12-month biopsy, 8 patients had no malignant lesion, and only 1 patient had 2 malignant lesions. The mean serum PSA decreased from 7 to 0.7. That means 89% decrease and remained low during 4 years of follow-up. During the MRI-guided TULSA, the prostate gland or target lesion received a median Tmax of 66 degrees Celsius and thermal dose of 9.5 by 10 to the 5 CEM 43. A median of 81% and 95% of target volume received adequate Tmax and thermal dose. In transitional zone and peripheral zone, the median Tmax were 72 and 64 degrees Celsius, respectively. A median of 7.8% and 16% of the transitional zone and peripheral zone received inadequate heating, respectively, and a median of 1.5% and 3.8% of transitional zone and peripheral zone received an inadequate thermal dose, respectively. Between 2.5 millimeter of urethra, median Tmax was 72 degrees Celsius, and only 1.5% of the volume received a Tmax more than 86 degrees Celsius. MRI-guided TULSA resulted in significant PSA reductions, as well as adequate treatment coverage in the prostate target volume in MR thermometry analysis of patients with low to intermediate grade prostate cancer. Our thermometry analysis showed that majority of prostate volume was adequately treated with Tmax more than 55 degrees Celsius and thermal dose more than 240 cm43. The segmental analysis showed that the transitional zone, due to proximity to the transducer inserted through the urethra, received a higher dose in comparison to the peripheral zone. Ultimately, the relation of treatment day energy deposition per region and clinical outcome can help to inform the optimization of treatment parameters. Thank you for your attention.